So scoliometer measurements, it is a portable device used for spinal curvature. For initial assessment, it is used by physiotherapist or any other occupational therapist, any other therapist to do. For the functional assessment, it's an evaluating impact of deformities in daily activities. The quality of life is an essential for treating plan. It is a functional activity based on task-oriented exercise that we can able to do the early interventions in the providing space with providing the objects and rest of the things. So, what are the research that mean advanced development in the scoliosis? Genetic factors, biomechanical models they used for the scoliosis, MRI studies enhancing insights, the loading studies track progressions. So, genetic factors, it is a genetic predisposition in idiopathic scoliosis indicating inherited influences of spinal curvatures. A simulation of demonstrate how asymmetric loading affects the vertebral growth, highlight the mechanical influence on the scoliosis progressions. The MR studies provide that increasing inside the spinal cord length, so that means this in the intervertebral disc. So in the intervertebral disc, we the how much of the disc displaced with an normal curvature to the alternate curvature. The displacement between the each vertebra it should be measured and it should be marked as disc bulge. So longitudinal studies track progressions means the Adlerson reveals that critical development periods of the interventions and treatment may be used for this longitudinal studies. So, what is the comprehensive treatment option for the vertebral deformities? The observation for mild cases, bracing for growing children's, surgical interventions for severe cases, and physical therapy for muscle support. So, in such cases, the comprehensive treatment are the mild cases we can check an early detection of mild scoliosis or early detection of the scoliosis patient. The curvature of spine we can be get altered while using the bracing. It may get altered by the growing children's, but it also we should see the effect of the scoliosis in the body. So surgical implants we can make spinal fusion or for the severe deformities or correction of spine alignment. It may get to provide stability. In such cases, we can move to grade 3. Grade 3 or grade 4, we can suggest the surgery period. Until then, we can with support. Until then, the patient can get support with an physical therapy, such as targeted muscle strengthening, enhanced posture, contributing the overall spine stability and mobility of exercise. So, innovative treatments are advanced surgical methods reducing recovery time for the patients with vertebral deformity. So, there is no time period to elaborate the elaborate the surgical methods. So, it is pretty normal to suggest the surgery for the grade 4 patients to manipulate it. So, spinal deformities, anatomic and biomechanics, the key insights we should take in this topic: anatomic and biomechanics, types of spinal deformities, diagnostic techniques, innovative treatment techniques, options, multidisciplinary approach. So, anatomy and biomechanics, the understanding the biomechanical part and the anatomical part is a crucial to diagnose the spinal deformity because it may get effective through this part, and the biomechanics is the most crucial role play in the diagnosing techniques. So spinal deformities types are there different types and unique implications in the patients with health and treatment outcomes. So what are the diagnostic techniques? There are different diagnostic techniques like MRI, CT, and physical examinations. It is used to assess the spinal deformities and tailoring the interventions, etc. So innovative treatment options may be include with innovative therapies like manual therapy, trigger point release, or kinesio taping like K-wire hangering, and ISTM soft tissue mobilization, and including the Mulligan mobilization for the mobilizing techniques. So these are the multidisciplinary approach with the spinal health with an doctor and healthcare professionals or etc. So hope you all understand about this topic. In such case, we can see another topic of management of spinal deformities. Thank you.